Hello, and welcome to Aging Insights. I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. In our last episode of Aging Insights, I was joined by several experts who answered the question, now what? And that now what was in regard to what do we do with this ongoing impact of COVID-19? And as we continue that conversation, we're going to sit down and revisit conversations we had at the beginning of the pandemic with also some of our favorite experts. I'll be joined by Dr. Joshua Raymond again to give us an update about what's happening in the healthcare system, and Dr. Charisse Smith to talk about what's happening in the education system now that schools are reopening. In addition to those conversations, we're also going to be talking with Lamin from the New Jersey Governor's Office of Volunteerism about the status of the foster grandparent program, and we're actually going to hear directly from one of their foster grandparent volunteers about her experience with quarantine. We hope you enjoy this episode. At the beginning of the COVID-19 pandemic, I sat down with two NJFA board members who also happen to be healthcare professionals, and they shared with us their experience as well as their expertise in dealing with the COVID-19 pandemic just as it was beginning. And now I'm joined again by one of those individuals, Dr. Josh Raymond, to give us an update about what's going on in the healthcare system and what the lasting and long-term impacts COVID-19 will have.
Just to refresh, the last time we interviewed each other was from the hospital,
Yes.
Really at the peak of the CentraState outbreak. There were 137 patients at the hospital with COVID at that time. And I was on a medical floor, nursing floor, and we had just transferred 19 patients from the Manor Nursing Home to be cared over there. And it was really kind of stunning period. So that paints a picture, second week in April of 2020. And now, as we get to the last week of September, the census of COVID patients at CentraState, for example, is less than 5. And we're very cognizant of any patient under investigation or any test that's still pending. It's my observation that the patients that are at the hospital don't seem to be quite as ill. They aren't on ventilators, but they are being admitted with respiratory problems and symptoms of COVID.
It's nice to know that things are improving and that there might be a little less stress on you and your colleagues than there was at the very beginning of this. But we do know that there is still continued risk, right, for individuals, especially older adults and those who might have, a compromised health status. So can you talk a little bit about advice that you as a physician and your colleagues in the medical profession might still be giving people about what to do and how to stay safe as things change?
As a clinician and a practitioner, I myself am being tested once a week with a COVID test to make sure that I'm not infected and not going to vector that on to anyone else. I personally keep my mask on all the time. I'm at least 6 feet away from individuals, and I recommend the same to people in the community that really keep your distance in public spaces and wear a mask when you're out in public. It seems that's the evidence that seems to be coming to the surface to prevent the spread.
The other interesting thing that I'd like to get your take on is the idea of telemedicine and these virtual doctor visits. As a practitioner, and someone who might be using that, what are some of the implications of long-term use of that? And do you think it's here to stay?
Let me take each one at a time.
Yeah.
I think it's here to stay. And I think the long-term implications to be seen. I think it was successful for me. The patients that I did take care of that I knew before the pandemic, it was as easy as catching up with them. They're old friends and speaking to them on the phone or on a video monitor. So I think that part will move forward. And at some point I'll see these people and patients in person again. So that's part of the question. And then the other is, I work at a federally qualified health center, and we were conducting and performing COVID tests, the saliva test. And a lot of the patients that I was speaking to or having a telemedicine encounter with, I may never see again. And that's, less personal on that. And as we speak, I'm writing a policy for our nursing facility to move forward with specialists, to get tertiary care specialists to come into the nursing facility, if you will, by telemedicine. So really improving quality and access to specialists. Also moving forward at coverage at night to have video teleconferences so that a doctor can see a patient if there's a change in a medical condition. Our hospital, and in addition to that, spent to the tune of, I think it's 7 digits to have a video telemedicine ICU after hours. So people are really putting big money into telemedicine. So I think it's here to stay.
Are there any other concerns you would have about long-term use of telemedicine?
Certainly, establishing that relationship in person is important. There are some procedures that need to be done in person, cancer screening tests, for example, and immunizations to be done in long term. But I think we're smart. We'll figure this out. And medicine has always been in a constant state of flux and change. So we'll change for this as well.
You know, sort of in thinking a little bit more about this, if people have questions, concerns, where do you recommend they go to seek additional information or guidance about their COVID precautions?
Sure. Start off with your primary care provider and schedule a regular maintenance visit. And also the CDC website. Recommendations are continuously changing. And also our governor, Governor Murphy's recommendation, his daily broadcasts, I think, are very informative.
Mm-hmm. That's great. There's certainly not a lack for information, so it's good to know what sources we can trust and where we should go for up-to-date information on that. Again, I'm so grateful for you taking some time to join us and update us, and glad to see that you're well, and I hope that you do stay safe.
Thank you. Thanks, Melissa.
Just as school was ending and students as well as their parents and guardians, which also includes grandparents, were hoping for a break from virtual learning, we sat down with Dr. Charisse Smith to talk about the impact that online school had on those individuals, as well as tips to stay engaged over the summer. And so we thought it appropriate to sit back down with her now that the fall is upon us and children are returning to school and still dealing with some online learning, to get some tips about that, as well as just find out what's happening right now as schools are reopening.
Well, Melissa, thank you for having me back again. Well, school districts and schools have been feverishly preparing for varying scenarios of learning while educating students. Some have begun remote, some are hybrid, and some are actually fully engaged, depending on if it's an independent school or Catholic school or public school. Some of the schools have already been retrofitted for these different scenarios, but many right now are preparing to pivot on a dime if we have to change. So if things change health-wise in a school, schools are now prepared to either go to hybrid or to full remote.
And I did want to ask you sort of what your experience has been and the difference between what's happening in public schools versus what's happening in private or parochial schools.
Well, my experience with the Catholic schools is that they prepared quite well in May, soon after school ended, and the buildings were retrofitted with signage and hand sanitizers, HEPA filters, plexiglass, and even the technology looks very different in the school that I'm involved with. And it almost seemed seamless for those students to come back. And on the other hand, because of the public schools are much bigger, have more staff, more buildings, the buildings are a bit older, and the fact of getting supplies in has been difficult. So we might not have the signage just there or the plexiglass or some of the other requirements that are needed for a safe reentry. We're still working on that. We're still working on that.
All of that kind of uncertainty has an impact not only on the staff and the students, but also on the adults that are attempting to assist these children and their learning, right? And in
Right.
particular, as we know in our conversations, we've talked about the impact on older adults, grandparents that are raising grandchildren and might be involved in the learning experience for these kids. So what have you seen thus far, or what do you anticipate seeing the impact being of that uncertainty really in, are they going to continue to go? Are they going to go in person? Are they not? Sort of business.
Yeah, there has been a lot of communication and establishing lines of communication. That was, I think, one of our toughest hurdles that we had to face was, does everyone have working telephone numbers, email addresses, cell phone numbers, and making sure that we're communicating in everyone's language, ensuring that they understand very complicated matters of just going hybrid from A day to A day, B day, possible C day, or remote, A week, B week. So it depends on your school district, what your hybrid looks like. And it was complicated for the teachers, and we kept asking questions and needing reassurance that we're going to be okay, but we have someone to talk to. We have someone to reach out to. So it might be your classroom teacher. It might be your school nurse. The guidance counselors, the office staff is essential during this time. Technology departments. There have been scenarios where principals have actually done home visits, socially distancing, of course.
Oh, wow.
To reach out to parents. There have been pop-up stations outside of school parking lots, where parents and caregivers and families can pick up laptops, exchange laptops, but also have that communication and face-to-face and reassurance that we're here for your kids, we're here for your families. So the communication is key.
Wow, there's so many moving parts to this, and so much, and you're right, communication is the key, and it's nice to hear some of the things that are happening to make sure that communication it happens, and it really touches on the equity of all of this, right? And who has access to equipment and the right type of internet, and how can we make sure that we're getting all the right information to the parents and the caregivers in the way that they can understand it and comprehend it the best. And so
and to understand that the process is not perfect.
Right.
We are evaluating every day, every hour, every week, and we're making changes where we see things that need tweaking.
That's really great to hear, and I'm so glad that you shared that. And it leads me into what I wanted to ask about in regard to all the precautions that we can be taking, right? So we've already recognized that there might be older adults in some of the households where these children live. And so if they're going to school in person, they may be coming home and exposing an older adult in their household to COVID. And we also have to recognize that some of the people that work in schools, whether they're teachers or support staff or other faculty, other staff in the school system, that might be older adults or who might be in some way compromised. And so for those individuals who might be concerned about their overall health, but also need to work or are part of a system that needs them, they're essential. How can schools be making sure they're addressing and putting the right precautions in place to protect those individuals?
Well, in both the Catholic schools and the public schools, the temperature checks, there are checks that some schools have actually on an app on your phone.
I've heard that.
Where they're asking you how you're doing, how you're feeling. If you're not feeling well, don't come to school. And again, the communication piece is very key. Communication within school buildings too, communication between the custodial staff and the administration, making sure that the rooms have been sanitized after they are in use. A lot of contact tracing is going on within buildings as well. Making sure that teachers who are not comfortable with coming back to school have what we call 504s, that they have underlying conditions and they are not to come back to school from doctor's orders. So again, Melissa, there are a lot of moving pieces, and just communicating with all of those pieces. I know teachers, we feel like we're zoomed out, we're meted out. But it's really great when you get the information or convey your concerns to someone who's making those decisions.
Right.
So we really communicate to parents that, when your child does come back to school, or if your child's coming back to school, don't send them if they're not feeling well.
Right. And that's a great lesson, right? I mean, we should have all been doing that to begin with. If you don't feel well, stay home, because you might have something that's contagious and you don't want to spread that. So I think that's great advice all around. If you don't feel well, stay home. If possible. And so that's the important piece. It's funny to me because I've had a couple of conversations with people that have school-age children who keep telling me how badly their kids want to go back to school. If they're not 100% in person, or if they're not in person at all, how badly they want to go. They miss their friends and they want to go to school. And so as we look for silver linings throughout this whole pandemic, isn't it sort of a great side effect that kids want to go to school?
Yes, it is. Teachers have felt we are so wanted. We have a very difficult job. We really do. Sometimes we wonder, what are we doing? And sometimes teachers get a bad rap, but when we hear kids say that they want to come back to school and they want to see their teacher, and hearing some of the funny anecdotes as I pop between different classrooms. I even had a mom in the background actually doing the exercise with the kids on video. It was the sweetest thing. And I said, "Hey, how you doing, Mom?" She was like, "Oh my gosh, you saw me." I said, "Yes, keep going." So we're really trying. Even you may have the student, but the parents are back there too, and they want the support and need the support from us as well.
Oh, what a great end note. To say that this is the highlight from our conversation. I think, Charisse, is communication is key, and that there's this desire from both sides, from the students, from the parents, from the teachers and the staff, that to want that connectedness. So thank you for joining us again and giving us a follow up and a recap of what's happening now.
Yes.
We're really glad to touch base again with you.
Yeah, and hopefully the next time we meet, we're all in school and we're all safe.
Oh,
that would be wonderful.
Here's to hoping. Thank you so much for taking the time to join me. I'm so glad to have both of you here with us today. Lauren, I'm going to start by just asking you to tell us a little bit about the organization that you work for and the volunteer programs that are available through that organization.
Yes, hi, sorry about that.
No,
this is our new norm, so.
Safety first. We're glad to see you practicing that.
My name is Lauren Lamin, and I am with the Governor's Office of Volunteerism, and we're housed under the State Department, who has various programs with civic engagement throughout the state of New Jersey. I am a program coordinator with the New Jersey Foster Grandparent Program, and we're under the Senior Corps banner, which is a part of the Corporation for National and Community Services. And I work with a bunch of great volunteers who are age 55 and older.
Right. Yeah, that's great. I mean, I know that the office, the Governor's Office of Volunteerism and the national organization you mentioned do a lot of work, but in particular, we were here today to talk about the Foster Grandparent Program, which you help to oversee. So could you explain to us a little bit more about what a foster grandparent is and what that program does?
Initially, when people hear the Foster Grandparent Program, they think of fostering, but our program doesn't work with fostering. In fact, we're volunteers over the age of 55 who work with children and youth with exceptional needs in their communities as role models and mentors. They help to create meaningful and lasting relationships, which really helps with intergenerational programs and services and things that they need.
So prior to the pandemic, the way the program worked is that these volunteers, the foster grandparents, would go into school settings. Is that correct, to work with those children?
Exactly. Majority of our volunteers are placed in classroom settings and institutionalized settings. So once the pandemic hit, it was A little bit scary for us because essentially when the governor did the executive orders to close close school buildings, our volunteers were at home at that time.
Yeah, and I'm sure that must have been difficult for everyone involved, right? For you as the staff running and coordinating those programs, for the volunteers themselves, and for the children in schools that benefited from their assistance, right?
It really was. It's very rewarding when I hear how the students just admire and love our volunteers, and they look forward to their affection and attention that they receive from our foster grandparents.
And so in dealing with that initial shock and dealing with the crisis, how did you then continue to try to engage the volunteers even though they weren't allowed to go into the schools?
A few of the things that they did were prepare meals for children to deliver them to their homes, and also to engage virtually, which was a little bit difficult at first because a lot of our volunteers are not so tech savvy, but a few of them are very tech savvy, and they were able to engage some of the classrooms via Zoom. And we have made it mandatory in our program to train our volunteers on Google Classroom and also Zoom to assist in that effort.
So you've been providing them with some technical assistance on how to use those platforms.
Yes, we have. We have indeed.
That's great. And you have one of those volunteers with you right now, Miss Lulu. Miss Lulu, who has instructed me to call her Grandma Lulu, even though if my mother is watching, she'll be mad at me because I should call her Miss Lulu. But Grandma Lulu, you are joining us today, and you are a volunteer with the Foster Grandparent Program. So can you tell us a little bit about what your experience has been during quarantine?
It's affected me in the fact I take naps daily. I eat 3 meals a day, which I never did. I'm walking every day. And I'm communicating with my family and friends, and I reach out to the classroom assistant teacher. I haven't met the new teacher, but I reach out to the classroom assistant teacher at least every other week to find out what's going on in the classroom.
That's great. It sounds like you've really found some positive ways to cope, making
Absolutely.
sure you're getting your adequate nutrition and rest and exercise, even, and staying socially connected with the folks from your program and your family, which is great.
Yes. I miss the little ones an awful lot. I became very, very attracted to them. I feel as though my nurturing skills added a warmth to the classroom, and now I'm not using them. And some of those nurturing skills were giving emotional support, encouragement to the children, praising them every day. And actually, I was a calming agent in the classroom.
Yeah, I can imagine you would be, and I'm sure they miss you as much as you miss them, and they're missing that interaction. I understand that an additional way that you were coping with this is that you wrote a poem about your experience in quarantine. Is that right?
Yes, I did.
Would you be willing to share that with us and read it for us?
I sure would. I would love to. What's happening all around me, it's so hard to explain, but all my friends and family are feeling the exact same. We cannot come near each other. The virus is the risk. No shaking hands or friendly hugs. The government insists. I eat all day and take long naps and watch the weeks go by. It's funny how I never notice how fast the time does fly. My days are long and boring. A few chores are complete, but who the hell will notice? There's no one around to take a peek. I have my thoughts, I have my fears. Where did this mole come from? I wonder, did the government have a hand in destroying someone's? It's touched the young and silenced the aged. The weak are at risk. This is surely not the end of time. It's God's way of telling us, slow down, look around. I am the only one who has a hand in this. Take heed, my chosen ones. You're left behind to tell the story of how the virus is putting us through hell. No work again today. I miss my little ones at school, their friendly smiles, their hugs and cries. Believe it or not, it got me through. I'm 80 now, and I've lived to see a day such as this. It carries long memories. I pray to God that all of us will take the hint and not the risk. God bless.
Well, that was wonderful. Thank you so much for sharing with us something so personal that you've used to help yourself through this. I'm sure that those who are listening will also find some relief in your words as well.
Thank you for asking.
I really appreciate you taking the time to do that. You know, Lauren, as we've been talking about the impact on the volunteers and on your program, I have to ask, you know, as schools are reopening, what does it look like or sound like for any potential returning of the volunteers?
The volunteers, like I said before, they're very, very excited and they're looking forward to get back to getting in the classroom into service. It is, we have to take precautions against them because they are part of the vulnerable population. But there is hope that they will be getting back pretty soon. There are a few schools that will be opening up in the month of October. And we have a handful of volunteers, although some of them are a bit nervous. And those that are nervous about going back into the classrooms, there's no penalty. They can stay home until they feel more calm or more at ease with getting back into service. And those that are ready to engage, they will be suited with PPE gear that we were fortunate to get from FEMA and be able to go in and get back to their, I guess, slight sense of normalcy.
No, this has been wonderful, and I hope, how can people who might be interested, even though there are right now some restrictions with involvement in the program, if people are listening to this and are interested in finding out more about the foster grandparent program or becoming a volunteer, how can they do that?
Definitely, they can find us on Facebook or they at the Office of Volunteerism /volunteer volunteerism. Or they can email me at lauren.lemaine@sos.nj.gov, and I'll be happy to extend information to them about how they can join us either by virtual service or limited in-person service as well.
Wonderful. Thank you both so much for taking time out of your day to spend with us. And again, Grandma Lulu, for sharing your personal poem with us. It was such a wonderful thing to hear. And so I'm grateful for both of you for your time and for sharing yourselves with us.
Thank you for asking.
Thank you.
Thank you for watching this episode of Aging Insights. For more information and to watch previous episodes, please visit our website, www.njfoundationforaging.org, and click on the Aging Insights page. We hope you enjoyed this episode and that you feel more informed about how to deal with the ongoing COVID-19 crisis. For more information about that conversation and others, please be sure to visit our website and to follow us on social media. And remember that if you're in need of services, the County Office on Aging is there for you. To find their numbers, you can visit our website or you can call the state hotline at 1-877-222-3737. Thanks for watching and be sure to tune in next time.